I have two cameras set up today. One's over here, one's over there. So one is on YouTube Live, one is on Facebook Live. Welcome to Center of Balance Live today. So COB Live numbers 36. Today's topic, we're going to talk about what are shoulder problem diagnosed. And the second one, further on, we're going to talk about what tests are there, okay? What tests for to diagnose shoulder pain, shoulder problem. So to be honest, so each shoulder problem has its own pattern of symptoms, right? And that can help you, your doctor of your acupuncturist or physiotherapists make a diagnosis, right? So most conditions make it painful to use or move your shoulder, but some make your shoulder feel stiffness. Okay, so we talk about the shoulder conditions. Okay, the condition of it is pain, difficult to move your arm, and stiffness or tightness. Okay, so all this, or tingling and numbness, all these conditions are very different. So if you suffer from shoulder problem, okay, so you need to think about it. If you come to see me or any practitioner, we want to know which movement that restrict you, okay, which movement that you can't move properly, and how far can you reach, and when you move those, when you move your arm, your shoulder, does it get pain, does the pain stop you moving? So we want to know this because this actually help us to diagnose. Okay. So now if you can, you can write down before you go and see a practitioner and write down what, again, some pain actually, if it happened at nighttime, especially it happened at nighttime, it doesn't present all the time. So write down where exactly is it and when it happened, or when you sleep, and what sort of position that make it painful, right? Because some shoulder pain is in here, but it actually run around. Okay, it's not stay in the same spot all the time. So it really varies. Okay, so if it doesn't, it's not there all the time. So write it down and or mark it on your shoulder. And when you go to see a practitioner, and you come to see me, or you go to see a doctor, you better show them what's going on, where exactly the problem is. Okay, because that actually help. So let's talk about what tests are there, because we really get in some cases we need some taste. Okay, so be in your mind that blood test is not normally used in shoulder pain, but we did mention one. Okay, one of the cases we need blood test. What is that? It's rheumatoid arthritis. Okay, the rheumatoid arthritis is you run a blood test and you can find the rheumatoid factor on the blood, and that is how we in all sort of arthritis that causing shoulder pain, and that's how we exactly diagnose this as rheumatoid arthritis. So it's very simple. So apart from that, not much. Okay, not much. Now, the more often thing that you do, okay, is X-ray. You heard about X-ray on shoulder, right? But before X-ray, what else can you do? Ultrasound. Okay, for a lot of injury, okay, you want to do an ultrasound. So there are a few different, okay, ultrasound, X-ray, and MRI. You heard a lot about of this, okay. So what are the different? Okay, what can they help us to diagnose the shoulder problem? Okay, if you have an injury, normally you go for ultrasound first. Okay, with your movement restriction. Why is that? Because ultrasound can show soft tissue. What is soft tissue? Soft tissue is muscles, tendons, muscle and tendons, right? Let me check my notes. And other soft tissue around the shoulder. Okay, most of the time you can see that most of the time I can see that it's the muscle and the tendon tear. That's from an injury or a fall. That's easy happen. Okay, all the time. Very very common. Okay, as I mentioned last night, some tear it will heal itself. You don't need any surgery, but I do recommend surgery if it's very bad. Okay, with my acupuncture, without acupuncture and Chinese medicine treatment, if you have the tear, that if we put needle in and it get pain relief and your movement increase, may improve, then in this case, not necessarily need a surgery. Okay, so I've done those cases previously, but most of the case, tear you have to go for surgery. Okay, this is something very different. Okay, that it can be diagnosed under ultrasound. Further on, so we talk about soft tissue with ultrasound, right? There are hard part. What does hard part mean? It means bone, okay, or harder structure that we need to use X-ray to show. If it's fracture, you need X-ray. So dislocation, you need X-ray, right? And as well as probably ultrasound. So one or the other, you can't cover everything. So what test can cover everything? MRI. But MRI is most expensive in shoulder test. You won't get straight to MRI most of the time. If you go to A&E, it might be MRI straight away, depending if a car accident, right? Otherwise, ultrasound first, and then for the soft tissues, and then X-ray for the bone to see. So you may find that there is some change in this bone, okay, especially with arthritis. But a little bit of change in the bone, it doesn't mean it really caused the pain, because a lot of pain is actually from the muscle tightness. Okay, the soft tissue is not tear, but it probably swelling or has some fluid in it. Okay, all this thing or some bruise in it, it all cause pain. So really, ultrasound, X-ray, MRI is just further test. Okay, most of the case you don't need those things to help to diagnose. Okay, so this is in the Western side to diagnose this. We use that as well as a Chinese medicine herbalist and acupuncturist. Okay, but also we have this. What is this? This is another way we diagnose the shoulder problem. Okay, and we use this. Okay, why do I use this? We actually look at the meridian. Okay, look at the meridian. So we have 6 different. This is about Chinese medicine. Okay, if you ask physiotherapists or chiropractor or osteopath or your doctor, they know nothing about this. Okay, unless they have been taking some course for acupuncture and they understand it. Otherwise, they don't know. So look at it. This is meridian. I'll show you here, and I'll show you over here. So I have 2 cameras here, as I mentioned. One is on YouTube, one is from Facebook. Okay. So all this meridian, for us and as an acupuncturist, we want to know which meridian involved. Okay. Once we know which meridian involved, each individual meridian connect to the organs. Then we know those pain on those meridian, we suspect that those organs are out of balance too. Then we need to ask further question, like how your bowel motion, how's your sleeping, how whether if bloating or not, if any other pain and joint pain, you grumpy or not, emotional problem. We need to ask those because those are connected to the organ as well. Okay, those are connected to the organ as well. So all this thing, or runny nose, itchy eyes, all this thing are connected to the organs. So we really want to find out. Okay, according to Chinese medicine. That's why I mentioned that stomach and spleen control your lips. Okay, it also control your muscle strength, structure and digest system. Then kidney and bladder control ear. Okay, it also control bone strength. Right, liver and gallbladder it control tendons and joints and nerve functioning in eyes. It also control the emotional side. If you get angry, depression, irritability, stress, impatient, that is your liver out of balance. If your liver out of balance, you're stressed. It's difficult to cope with when things happen at work or family. Okay, so this thing it make your muscle tighter and tighter, and it doesn't help your shoulder to recover. Okay, this is something that it's we've been talking about this for years, 1,000 years, and now a lot of people realize that wow, stress really making your body painful. Yes, that's right, because the tendons can't recover properly. And if you have a digestion problem, you got diarrhea every day and bloating and burping or heartburn, all these symptoms I just mentioned are from your stomach and spleen, digest system. And stomach and spleen control muscle strength. Okay, if your muscle over here, sorry, if your muscle strength are not good, then you won't heal and you won't recover properly. Or you will find that you've been treating and seeing physio, osteopath, chiropractor, even acupuncturist. If what I mentioned, those people just treating your symptoms without looking at the organs imbalance, without treating the organs imbalance, you find you still get result, you get relief, but it doesn't last. It will soon turn to chronic pain, chronic shoulder pain. You always have it. That's because in Chinese medicine, when we treat the symptom, shoulder pain, we really want to treat to investigate to find out whether there are any organs imbalance. When we know there are organs imbalance, we want to treat the organs because organs are the root of the entire body. Not until you treat the organs imbalance, which in other words, constitution. So when you treat the constitution plus treat the symptoms, and you find the symptoms, shoulder pain, will recover properly and it will recover faster. The result will speed up. Okay, so this is something very different and diagnosed in Chinese medicine and other doctors and physio or chiropractor or osteopath. Okay, there's nothing wrong with that to see anything because I do refer patient to chiropractor, osteopath, and physio. Okay, because those treatment are very help my patient as well. So I work with those friends. Okay, to get my patient back to recover as soon as possible. So if you are seeing chiropractor, osteopath, physiotherapy, any of them, and you find that your symptom come back quickly or it slowed down or the relief doesn't get any further, this is my best advice for you. Instead taking painkiller, come and see an acupuncturist to find out an acupuncturist who really care about to treat the root of the problem. I'm not saying there's no judgment, but I want to tell you that not every acupuncturist are equally the same. Because as you know, if you come to see me, I may just treat your symptoms. I don't care about the organs, right? But I don't want to miss it. Okay, so some practitioners maybe just treat the shoulder. They don't treat the root of the problem. But for us in our clinic, we have a rule. Everyone come in, even just pain relief treatment, we want to know the constitutions. We want to know the organs in balance. Because when we treat the organs in balance, over the years, we have good results, very successful to treat shoulder pain, okay, by treating the imbalance of the organs as well. Okay, so that we're gonna finish tonight talk. This is all about shoulder test, and I just share with you what we use for shoulder test, and X-ray, MRI, and ultrasound, and what about in Chinese medicine and acupuncture? We use meridian, we use organs theory to diagnose as well. So here you go. This is our clinic number 078467956. Okay. So if we offer pre-assessment, if you happen to have a shoulder pain and you would like a free pre-assessment, up to 15 minutes are free, call 07846 7956. You're welcome to get a free pre-assessment. Okay, you stay awesome and I love you all. See you. Bye-bye.